To help us sort all of this out, I'm joined now by Dr. Ashish Jha, Dean of the Brown University School of Public Health. Doctor, thanks so much for taking the time.
My pleasure. Thanks for having me here.
First, I want to know if you were surprised by the FDA panel's decision not to recommend boosters for everyone over 16, or was there just not enough data yet?
You know, I was not surprised. I think the data has been pretty clear on this, that for high-risk individuals, boosters make a lot of sense. For young, healthy people, we're just not there yet. We don't have enough compelling evidence to suggest that they need it, and we should wait until we have more clear evidence that that would be a helpful thing to do.
The Biden administration has, as you know, faced some criticism for getting ahead of the scientists on this issue, although they do point out that they were planning for boosters was pending on FDA and CDC approval. But from a public health perspective, any concern that this vote against boosters for most Americans will create confusion in the vaccine effort, since there's so much disinformation and confusion to begin with?
Yeah, I am worried the messaging here has not been as good as it needs to be. The number one message that every American needs to hear is that the vaccines are working. And especially if you're young and healthy, you absolutely need to be getting vaccinated. You need to get that first shot and second shot. The real question has been around third shots for high-risk people. And I appreciated the FDA's advisory committee saying that would be a useful thing. But the key for everybody else, for the rest of us, is get your first and second shot. That's what's going to prevent you from getting into the hospital and prevent you from dying.
Pfizer relied in large part on data from how this is all playing out in Israel on the need for boosters, at least. But some panel members said that's a bit of an apples and oranges comparison. Why is the U.S. situation different from what's being seen in Israel, at least in the need for boosters?
Yeah, you know, so Israel is just one of the countries. There are boosters now being used in the UK and Germany, so we can look to other countries as well. Israel's a small country, of course, and they did a very good job of getting a lot of people vaccinated very quickly. So I think some panel members thought, well, we should really be looking at data from other places, including the United States. But fundamentally, I do think the data from Israel is an important part of the consideration, and I'm glad that it ultimately was used as a part of the decision for getting high-risk people that booster shot.
So as you point out, the panel did vote unanimously in support of boosters for those over 65 and those at risk of serious disease. Do you anticipate the CDC will follow that lead? And if so, here's the question: how soon would boosters likely be available for those groups?
Yeah, so I do think CDC is going to follow that lead. And I think what you're going to get from the CDC, hopefully in the next few days, 3-4 days, is a bit more refining. So what do we mean by people at risk for serious disease? They're going to probably set those criteria much more explicitly. And my take is probably by the end of next week, we should start seeing more and more people get boosters. This should not be something that people have to wait for very long.
We heard that several panel members do note that vaccines remain effective against serious disease and death. Based on what you've seen in the data, do you think that protection against serious disease will continue to last, or could that eventually wane as well?
Yeah, so we're going to have to follow the data, of course, on this, and we don't know. But so far, 6-7 months out, again, young, healthy people, looks like they are very, very high levels of protection. My expectation is that it will continue for some period of time, but we're going to want to monitor that very closely. And if we start seeing waning, then we're going to obviously want to expand the boosters to a much broader population.
Finally, we have seen some alarming statistics with the U.S. daily death average rising 600% since the middle of the summer alone. But the CDC is predicting hospitalizations will actually drop this month. Does that mean that the Delta variant may have peaked, or could we still see a surge as we head into the fall and winter months?
Yeah, it's a really good question. I do think that the Deep South, which saw the huge surges over the summer, I do think that that has peaked at a high level, so a lot of people getting infected, getting sick, dying. But I'm hoping that those numbers will come down. I worry about the northern half of the country, the Midwest, Great Plains, even here in New England, with fall approaching. I think we have to be concerned, and we just have to get more people vaccinated.
Doctor, final question. You're helping us unpack this, sort through all of this. We've gotten new data. We've got the decision now from the panel. If someone is at home watching us right now, thinking to themselves, I'm confused, there's so much information, who would you tell people to listen to right now, or where should they be getting their information?
Yeah, it's a very good question. There's a lot of information out there. For me, the reliable sources remain the CDC. The expert I personally trust the most is Dr. Tony Fauci, who I think is our nation's premier expert on this. It can be confusing, but you've got to really listen to people who've been working on these issues for decades and understand them better than everybody else.
Solid advice. Dr. Jha, thanks so much for taking the time tonight.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.